Hi everybody, Brenna Cantner here with Nexus Youth and Family Services. This is our March 2021 Wellness Workshop on hoarding disorder. All right, so we're going to start with the basics of what is hoarding disorder. So people that are diagnosed with hoarding disorder excessively save items that other people would typically view as worthless and have a really hard time parting with possessions. So it tends to lead to clutter, and that clutter can overwhelm their space. It can disrupt their living space, their workspace. I'm sure everybody's seen pictures of like worst case scenarios where it's like piled up in its pathways through a home. One important thing to remember is hoarding is not the same thing as collecting. So collectors look for specific items and might organize or display them. People with hoarding disorder kind of save items and store them haphazardly, that they are just kind of stacked up and piled. In most cases, they're saving items that they think might be valuable or have some sentimental value. Sometimes it increases the feeling of safety. But ultimately it comes down to excessively saving items that other people are going to view as worthless. Okay, so hoarding disorder occurs in an estimated 2 to 6% of population and typically leads to problems functioning in daily life. So just some other information around research on hoarding disorder. It's more common in males than females, more common in older adults. And there's some ages here, 3 times as many adults 55 to 94 are affected when compared to adults ages 34 to 44. So just some statistics on the research on hoarding disorder. Okay, so some possible consequences. When you're talking about hoarding disorder, kind of depends on the circumstances and what your living situation is, but ultimately hoarding disorder can cause problems in relationships. It can cause problems in social and work activities and other important areas of functioning. And that's really one of the precursors for diagnosis, is that there's impairment, whether it's discord with, it talked about older adults. So, with your adult children, that you are struggling with your relationships because they're trying to get you to clean up, and you're like, there's anger around that. Like, it creates these uncomfortable dynamics in relationships. Another big consequence of hoarding is health and safety concerns. Big one is fire hazards, tripping hazards, and health code violations. The health code violations are especially true like when it comes to animal hoarding, because it's hard to clean up after that many animals. And as I had mentioned, it leads to that family strain and conflict, so therefore isolation and loneliness, people not wanting to be in your home, inability to perform daily tasks, right? When we think about those circumstances where there's piles of things and it limits your ability to get to a bathroom or cooking, it just it can really wreak havoc on daily life. Okay, so diagnosing hoarding disorder. I've kind of touched on all of this a little bit, but individuals with hoarding disorder have difficulty discarding items because of this perceived need to save items and this level of really severe increased distress associated with getting rid of those items. There's also this piece that the symptoms result in the accumulation of a large number of possessions that clutter areas of the home and workplace that essentially render the home or space not usable. And then, as I was just mentioning, the hoarding disorder, causes distress and problems in social work, other areas of functioning, maintaining a safe environment for yourself and others, relationships, all of those important components, like that's a big one when it comes to hoarding disorder, is the impact to relationships. Some specific symptoms for hoarding disorder include ongoing problems throwing away or giving away possessions regardless of actual value. Problems are due to perceived need to save the items and distress linked to parting with them. Items filling, blocking, cluttering active living spaces, so it can't be used. If living spaces are clear, it is typically due to the help from others, but it also is something that causes significant distress. And then I touched on this a little bit, but animal hoarding involves acquiring like large numbers of animals that tend to be kept in small spaces, inappropriate space, not cleaning up after them, and it creates these really unhealthy and unsafe living conditions for the person and the pets. So some example questions that you might be asked if you are having issues with hoarding are listed below. So do you have trouble discarding things that most other people would get rid of? How difficult is it to use the room and surfaces in your home because of clutter? To what extent do you buy items or get free things that you do not need? To what extent do hoarding, saving, clutter, how does it affect your daily functioning? How does it interfere with schoolwork, social family life? And how much distress do those symptoms cause? Those are just some examples of questions that may be asked in an assessment. Some individuals with hoarding disorder may recognize that they have a problem with accumulating things, and others may not see the problem. In addition to those core features that we talked about, people with hoarding disorder typically also can present as indecisive. They might procrastinate, they might seem disorganized or distractible. Those are some features that can contribute to those problems of functioning and overall severity of hoarding disorder. Many people with hoarding disorder also experience other mental disorders, including depression, anxiety, ADHD, and maybe some issues with substance use. It is not known what causes hoarding disorder, but there's always research being done on these things, and so there are identified risk factors. So hoarding is more common among individuals with family members who have experienced hoarding, but possibly brain injuries have also been found to cause hoarding symptoms. Stressful life events such as the death of a loved one can also trigger or worsen symptoms of hoarding. Okay, so the biggest treatment, I guess I'm going to start with saying that hoarding disorder is treatable. There are two main types of treatment that can help people with hoarding disorder. The first one is cognitive behavioral therapy, and the second is medication, which would require an assessment and evaluation from a doctor. Cognitive behavioral therapy could be done with a therapist. With cognitive behavioral therapy, the goal is to shift your perceptions in your brain around the presenting issue, in this case, hoarding disorder, that would encourage individuals to gradually learn to discard unnecessary items with less distress. That would be the goal. And so they learn to improve skills such as organization, decision making, and it changes their perceived need to save those possessions. And so the goal with cognitive behavioral therapy is to increase coping skills to lessen the distress around discarding items. If you know someone who is experiencing symptoms of hoarding disorder, or if you are, you can contact your doctor or a mental health professional. And in a lot of communities, public health agencies can also help address problems of hoarding and offer getting support to that individual. In some instances, it might be necessary for public health or animal welfare agencies to intervene depending on the circumstances, but ultimately there are resources in your community. If you know somebody who is experiencing these symptoms, if it's a family member or a friend, these are kind of some easy 4 steps to support that individual. So taking the time to learn about the condition, hoarders.com is a really good resource around kind of helping understand the intricacies of hoarding and how best to support and approach your loved one. Talking to a mental health professional. There are, again, that hoarders.com, there are resources, like even financial resources, like they pay for your first, the client's first appointment with a mental health professional. It's pretty cool. Kind of aligning your expectations and managing your expectations. And, you know, if we get to the place of kind of cleaning up, discarding items, recognizing the space might not be exactly how you want it, but the goal is, you know, to make some progress, and not impose your expectations on your loved one, but to offer support in making some movement forward. And then care, so providing just empathy and support. The most important thing is safety, physically and mentally, and so it can be a frustrating process, but it is their process, and your goal should be to provide some empathetic support in order to support change. So here on this slide, what I've included are 31 things to declutter in 15 minutes or less. Kind of looking through this, like the holiday stuff. I have a lot of holiday decor. Like I probably couldn't go through it in 15 minutes, but that's neither here nor there. Love Christmas. But, you know, going through kitchen utensils, expired pantry items, DVDs that are scratched or you don't use them, cleaning supplies, going through your fridge, freezer, and kind of getting rid of stuff that's freezer burnt or expired, craft supplies, hall closet, junk drawer, all of these things. Kind of, if someone is in a place to declutter and start in a small space, this is a good way to do it. And then there's over here is hoarding help do's and don'ts. So connecting with the individuals, seeking professional help, talking about safety, promoting donation, being patient, hiring a professional service. And then the don'ts, just to name some: getting angry, trying to reason with the hoarder, trying to touch their items in the beginning, you know, asking why they hoard in a disrespectful tone, making fun of the situation, just being gentle around it. So there are different ways to approach this, and there are people that can support you if you are needing support in supporting your loved one. Here I've included some resources. So there's a question and answer on American Psychiatric Association website. There's information on that hoarding website that I had just talked about on how to help a loved one. There's webinars. There's a podcast called Hoardganize. You know, Psychology Today, your local public health agency, your local mental health and behavioral health agency. And then there's also books on hoarding, and some other useful websites here listed on the right-hand side of the screen. As always, thank you so much for joining us. We will see you next time. If there are any topics that you would like to see us present on, please let us know. We want to make sure we are serving the community and getting information out there that can be helpful. So if there are topics that you would like to see, please call, please comment, send us a message on Facebook, whatever it is. We would love to get those topics out to the community. All right, you guys take care, and we'll see you next time.